This presentation will be looking at the social gradient of health, but particularly focusing on the influence that income inequality has on health outcomes. The social gradient of health generally indicates that the lower the socioeconomic status, the poorer the health. It predominantly exists due to poor access to education and health services and reduced availability for employment. There are several factors that determine health, and these are known as the social determinants of health. These are circumstances in which people are born, grow up, live, work, and age, as well as the systems that shape the conditions of daily life. These might include stress, early life, work, unemployment, social exclusion, addiction, food, transport, and health services. Today, we will be focusing on the influence that income inequality might have on people's health. So what does income inequality mean? Income inequality is a difference in economic status among individuals, communities, and populations. It may vary between societies, historical periods, economic structures, and systems. Societies with the widest income gaps, such as the USA and UK, have greater health inequalities compared to Scandinavian countries. These health inequalities negatively impact on life expectancy. Lower socioeconomic populations in countries with larger income gaps experience decreases in life expectancy. This pattern indicates that countries with a more even distribution of income have higher life expectancy. Income contributes significantly to one's ability to maintain overall health and well-being. Factors such as family income, access to education and employment, and access to health services can determine whether a person has a low or high socioeconomic status. In Australia, the government allows the population's income to be more equal due to the notion of shifting money from high income earners to low income earners through the tax and transfer system. Taxes help reduce income inequality as individuals who earn more than an average person pay more taxes. This gives the government more funding to assist low income earners to provide them with benefits such as Centrelink, child support, and rent assistance. There is a striking social gradient in health and disease running from top to bottom of society. Growing evidence of the correlation between income inequality and breakdown of social cohesion has been established, as well as evidence in increasing mortality rates and increased prevalence of violence and crime. Due to low income and poor access to health services, the social cohesion breakdown also contributes to a wide variety of health issues. Most worrying of these is the increased prevalence of cardiovascular disease. This is predominantly caused by alcohol and drug abuse, smoking, overeating, and physical inactivity, which is often triggered by high levels of stress, social isolation, and exclusion. Also, with the income inequality comes negative social and health effects such as infant mortality, obesity, decreased levels of trust, drug and alcohol addiction, higher homicide and imprisonment rates, and mental illnesses. By addressing income inequality at the policy level, many inequalities can be reversed. Reduced inequality within education, employment, and access to health services will eventually lead to better health outcomes.